The root canal procedure is a routine dental procedure which is carried out to repair a tooth that has suffered severe damage or damaged or infected. This procedure involves the removal of damaged or infected pulp from the interior of the tooth, cleansing and disinfecting the root's canals, then seal the tooth to avoid the spread of infection. Though root canal therapy is generally successful in saving the tooth, many are wondering what the rate of success for this method actually is. Based on the American Association of Endodontists, the percentage of success with root canal therapy is typically quite high, with close to 95% of cases getting success. In most cases, the tooth which was treated for root canal can be saved and be functioning as normal for a long time to come. A variety of factors influence the outcome for root canal therapy. The most crucial elements is the knowledge of the dentist who performs the procedure. The root canal procedure is one of the most delicate procedures that needs precision and skill in order to achieve a satisfactory final result. This is why it's crucial that you choose a licensed and seasoned endodontist who can perform your root canal therapy. Another aspect that may impact the effectiveness of root canal treatments is the degree of damaged or infected tooth. When the infection is very severe or the injury to the tooth is significant, it is possible that the rate of success for the procedure could be reduced. In these instances, additional procedures or treatments may be needed to save the tooth. It's equally important for patients to adhere to the directions of their dentist after treatment to ensure the highest chance of success with root canal treatments. These could involve taking prescribed antibiotics, refraining from certain activities or foods, making sure to attend follow-up appointments when the schedule requires. Following these steps, the patient can get the most out of their root canal treatments. In some instances, it is possible that root canal therapy will fail and the tooth could have to be removed. This could be for many reasons, for example, a fresh tooth infection forming as well as a crack in the tooth that can't be fixed or effectively seal the tooth following the treatment. If this is the case, removal is often necessary to stop any further problems and protect the health of the adjacent gums and teeth. In general, the rate of success of root canal treatments is extremely good, with nearly 95% of the cases getting successful. When choosing a certified and seasoned dentist, adhering to all instructions after treatment, as well as addressing any concerns promptly, patients are able to improve the likelihood of having success. If you're in the need of treatment for your root canal, ensure that you speak with an experienced and trusted endodontist who can discuss the alternatives and guarantee the most favorable results for your dental health.